So breast cancer is increasing worldwide. It's quite common, is much more common than what we found 50 years ago. It's not just about increased detection, because it's not just about women having more mammograms, but it is increasing, and it's predominantly due to increase in obesity worldwide. So I want to talk to you about the 12 risk factors contributing to development of breast cancer. One is, as we all grow older, the risk of any cancer increases, so old age. And in women, inheritance of the BRCA1 and BRCA2 gene. Early menstrual period, that again is a risk factor. Late or no pregnancy. Menopause after 55 years. Being physically inactive, overweight or obese, hormone therapy or for any reason, a family history of breast cancer, that's very important, excess alcohol consumption, night shift workers, predominantly night shift workers tend to put on more weight, so indirectly it's due to obesity, and then smokers. So these are the 12 important risk factors, but there could be other risk factors as well. But it's very predominant in postmenopausal women. So this is why it's very important for menopausal women to lose weight, reduce the waist circumference, and have regular checkups. Now, I've discussed about the risks of breast cancer. Now I'm going to talk to you about why should obesity cause breast cancer. That's very interesting. Why just putting on weight, just eating more, gaining weight should cause a cancer? We all know that cigarette smoking causes lung cancer, alcohol causes cancer of the stomach. We all know that. But why would food, just eating too much, cause cancer of the breast? In fact, even colon cancer, and there are at least 13 different other cancers related to obesity. So let's look into why obesity causes breast cancer. The fact that we say someone is obese means that the fat content is more. It's not just the weight. That means the fat percentage is more in that particular person. Fat is not an inert organ. It's not just an organ which insulates your body. It's a very important organ which is involved in metabolism, reproduction, cell growth, and much more. In fact, it produces so many other hormones and chemicals. So fat is an important hormone. Now, why would increased fat lead to cancer, specifically breast cancer? So I'm going to elicit a few reasons. So as I said, fat produces lots of enzymes and hormones. So and one of them is insulin-like growth factor. It actually indirectly causes an increase in insulin-like growth factor called IGF, insulin-like growth factor. So insulin itself is a growth hormone. It promotes growth. So higher the insulin, higher insulin-like growth factors, it promotes growth and promotes cancer cells. So that's reason one. The second is cytokines. Cytokines are cell signaling molecules that help cells to communicate with one another. They stimulate movement of cell towards the site of inflammation, infection, and injury. So according to one research by scientists in Germany, they found that obesity leads to release of cytokines in the bloodstream, which leads to changes in the metabolism of breast cells, making them more aggressive. Basically, the fat cells produce more cytokines that they all go towards the areas where there is more inflammation and makes the breast cancer more aggressive. So that's the second reason. In fact, there was one study which showed that if your body mass index, which is the measure for obesity, which is a very simplistic measure, so let's say your body mass index is 32 and increases to 37, the risk of developing breast cancer could go up by 12%. That's massive. So you need to be aware of that. With each increasing point in your body mass index, the risk of breast cancer also increases, and it's much higher in postmenopausal women. This is why I keep telling my patients who are postmenopausal to have regular checkups, mammograms. As I mentioned in my previous video, women who gained 5% weight had an increased risk of developing breast cancer. Similarly, when women lose weight, especially this was found in women who had bariatric surgery like sleeve gastrectomy or gastric bypass surgery, when they lost weight, the risk of developing breast cancer also came down. So there's clearly a relationship between breast cancer and weight. So as I mentioned in my previous video, please do not get fixated with just weight. Make sure your waist circumference also comes down. So I've dealt with the 12 risks for developing breast cancer. I've dealt with why obesity should cause breast cancer, but I think I missed one point. I need to tell you that estrogen, which is produced by the fat cells, also leads to cell multiplication and risk of developing breast cancer. So there's another point. So it's not a whole comprehensive reason I've given for development of breast cancer. I've just highlighted one: insulin-like growth factor, the cytokines, estrogen, but there are lots of other reasons as well, which I don't want to dwell into at this stage. But I'm going to take up a specific video, especially why fat tissue causes cancer. How can you reduce the risk of developing breast cancer? One, lose weight. It's not as easy as it is. You need to be very focused and it should be consistent. You should not just do it because summer is coming. You should do it gradually and it should be sustained. Limit your alcohol intake, stop smoking, increase your physical activity. If women are getting pregnant and they should go on to breastfeed, please do not avoid breastfeeding. Limit the dose and duration of any hormone therapy. Avoid exposure to radiation because that also causes breast cancer. And more importantly, if there's a family history of breast cancer, especially if there's a BRCA1 or BRCA2 gene, it's important you seek help, have regular surveillance, mammograms, blood tests, and make sure. So all these will help you prevent developing breast cancer. There's actually an important study going on. The results, I think, are not still out, called the Breast Cancer Weight Loss, BWEL, which is trying to find out if losing weight can reduce the risk of developing breast cancer. But until we have more information, I would plead with my patients and those who are listening to this video, if you are postmenopausal, if you are overweight or obese, please check your waist circumference. Please start adopting a healthy lifestyle. Even a 5% weight loss is hugely going to reduce your risk of developing breast cancer. Thank you for now.